Caring for a sick or hurt child takes great compassion, knowledge, and insight, as well as a friendly smile. And that's exactly what you'll find as soon as you enter pediatrics.
Well, the atmosphere in pediatrics is very upbeat. The walls are painted in the rooms, and we have tiles on the ceilings that are painted. It's a very lively atmosphere. Kids are great because they are happy even when they're sick. The nurses enjoy the atmosphere because they get to play as well as work. There's bears and stuffed animals, and we have bubbles and all kinds of fun things for the kids even when they're sick and in the hospital.
Jessica, obviously children and their families have different needs when it comes to their health care. How do you accommodate for those needs?
Well, I think with children, you have to remember that you're dealing with the child who's a patient as well as the family. And so we remember that children are at different developmental stages. We have infants and toddlers and adolescents. And so you have to explain what's happening at a level that they can understand, but you also have to explain it to the parent and the grandparent in a way that they can understand. We have different resources. We're standing here in the playroom, which is a great place for children to come and play during the time of their visit when they're healthy enough to. We also have a Ronald McDonald room where the parents can get away and out of the patient room and take care of any information that they need to while their child's in the hospital.
All right, tell me a little bit about your kids' corner, because that's really unique as far as an outpatient unit within pediatrics.
Yeah, it's an outpatient unit. It's right here on the same floor as the inpatient unit. Kids can come if they need blood work drawn or any type of procedure or the same day outpatient surgery. They can come right in, and they'll have nurses that are used to dealing with kids to do things like put their IV in and prepare for the procedure. You know, they have the procedure done, they come back to Kids Corner, they get all the education and information they need to care for their child at home.
Anytime you have to bring your child into the hospital, it's, you know, a scary, stressful experience, but knowing you're bringing them into people who are caring and knowledgeable definitely makes it easier. They always ask about the parents' needs, my needs, as well as the needs of the boys. They try to make sure we're, you know, comfortable and have everything that we need.
And speaking of the staff, the way I see it, you really have a twofold role. You're a medical care provider, but you also have to lend a sympathetic ear.
Yes, you're definitely right. The nurses here very much provide excellent medical care, but they also have to listen to families and their concerns and worries about the child, as well as take care of the child and understand what's going on at their level. And a lot of times children don't understand why they're in the hospital and why we're having to stick them with needles or do procedures that they don't like very much. And so we have to be very sympathetic in their care, as well as providing good medical care as well.
Since we've started bringing Evan and Zach in here to pediatrics, there's been a lot of changes. They're smiling, happy babies who the staff have grown to love and really treat us like family.